Hello and welcome to another video about lecture. Last time we talked about Charak Samhita and Ayurveda. In this lecture, we'll be talking about Sushrut Samhita. So this is Sushruta, Rishi or Muni Sushruta. And let us now understand his contributions towards our Indian knowledge system. His contributions are uh, carefully written or carefully collected in Sushrut Samhita. Sushruta was a seminal figure in ancient Indian medicine. He was often regarded as the father of surgery in context of Ayurveda. His contributions, particularly to the field of surgery and surgical techniques, are detailed in Sushrut Samhita, one of the key texts of Ayurvedic medicines. Sushruta was an Indian physician, a surgeon. Sushruta is credited with pioneering various surgical techniques and practices that laid the foundation of surgical science in ancient India. So he first invented surgery. That's why he is called as the father of Indian surgery or father of surgery. So these are the instruments that are used. These are few of the instruments that are used by Sushruta to conduct his surgery. Now let us quickly understand about his period, his cultural context and his legacy. First, let's talk about in which period his works were developed. So his works were developed in, of course, Vedic period, a time when Ayurveda was flourishing as the structured system of medicine. Okay. Now let us understand the cultural context. During Sushruta's time, India had a rich tradition of medicinal knowledge and practice. Ayurveda was well established and there was a significant emphasis on holistic healing, including surgical techniques. His legacy endures through continued relevance of Sushrut Samhita in both historical and contemporary medical contexts. Let us now understand why he was called as, or he is still called as, father of surgery. Sushruta is often celebrated as father of surgery due to his pioneering contribution to the field of surgery in ancient India. His work, detailed in Sushrut Samhita, is considered one of the earliest and most comprehensive texts on surgical practices. His contributions now, we'll talk about his. First, he was famous for this rhinoplasty. Rhinoplasty means reconstruction of nose, and he was also famous for cataract surgery. You might have heard the condition of an eye called as cataract. मोतीबिंदू मराठीत ज्याला म्हणतात. सो त्याची सर्जरीचं इन्व्हेन्शन सुश्रुताने केलंय. The surgery of cataract was invented by Sushruta and rhinoplasty. नाकाच्या सर्जरीचं सुद्धा contribution हे आपण सुश्रुतला देऊ शकतो. It outlines over 300 surgical procedures, including techniques for performing complex surgeries like rhinoplasty, which is the reconstruction of nose, and cataract surgery. It provides detailed instructions on how to conduct surgeries, including methods for incision, excision, and cauterization, showcasing a deep understanding of surgical techniques. So this is nothing but he talks about everything that is included in the surgery. Sushruta describes more than 120 surgical instruments, some of which were used for specific procedures. These instruments included scalpels, needles, forceps, many of which were designed with precision for different surgical tasks. So see, here you will see Mukha Yantra, Tala Yantra, then Snuhi Yantra. Okay, so this is how he described more than 120 surgical instruments. There are many surgical instruments which were used by Sushruta for different medical techniques, for different surgical techniques. Sushruta emphasized the importance of understanding human anatomy and physiology. The text includes detailed descriptions of the human body, its organs, its functions, which was crucial for effective surgical practices. So this book of like the Sushrut Samhita, it involves human body, the description of human body, the organs within the body, and the functions of the organs. So these things are, of course, obviously included in Sushrut Samhita so that it is effective for surgical practice. His anatomical knowledge was advanced for that time, providing foundation for safe and effective surgical inventions. Preoperative and postoperative care. So Sushruta also talks about preoperative, means before operation, the care that is given to the patient before operation, as well as postoperative means after operation. Okay, the Sushrut Samhita covers not only surgical procedures but also preoperative and postoperative care. It includes guidelines on patient preparation, wound management, and recovery. This holistic approach underscores Sushruta's understanding for surgical, entire surgical process from preparation to recovery. This holistic approach underscores Sushruta's understanding of entire surgical process from preparation to recovery. He also emphasized the importance of medical ethics and proper training for surgeons. He emphasized that a surgeon should have a deep knowledge of anatomy, surgical techniques, and patient care. His teachings included the need for a surgeon to be skilled, compassionate, and ethical in practice. Nowadays, compassionate surgeon is very rare to find. So his teachings included this. At that time, it was mentioned that a surgeon should be skilled, then he should be compassionate, he should have love for patients, he should have love for his own practice. So he also talks about this. Sushruta also talks about ethics in practice. What ethics should be followed by practitioners to conduct a surgery or to run a clinic. Okay, reflecting an advanced approach to medical professionalism. So this reflects an advanced approach to medical professionalism. Sushruta stressed the importance of medical ethics and proper training for surgeons. He emphasized that surgeons should have a deep knowledge of anatomy. I have already. Yes. Let us now talk about Ayurvedic diagnosis. To understand medical diagnosis in Ayurveda, we must first understand the role of Prakriti in health. The role of Prakriti in health is twofold. The first is individual health balance, and the second is prevention and wellness. So, first, we'll talk about personalized medicine. Okay, Ayurveda uses the concept of Prakriti to tailor health and wellness strategies to individual needs. Understanding one's Prakriti helps in recommending specific diets, lifestyles choices, and treatments that align with their unique constitution. So, first is personalized medicine. for individual health balance. Now the second point under individual health balance comes that is prevention and wellness. By identifying one's Prakriti, individuals can make proactive choices to maintain balance and prevent imbalances that may lead to illness. Okay. For example, a person with Pitta dominant Prakriti might be advised to avoid excessively spicy food to maintain their. After individual health and balance, let us now talk about diet and lifestyle. Dietary recommendations in Ayurveda are based on Prakriti. For example, a Vata dominant person might benefit from a warm, moist, oily foods to counteract the tendency towards dryness and coldness. Lifestyle practices such as exercise, sleep, stress management are also personalized based on the Prakriti. For instance, Kapha dominant individual might be encouraged to engage in regular physical activity to counteract their propensity towards lethargy and weight gain. The role of Prakriti in health also is about imbalance and diseases. So first we need to understand imbalances. Then there are customized treatments according to a person's Prakriti. Imbalances in doshas relative to one's Prakriti can lead to various health issues. For example, Pitta imbalance might result in conditions like inflammation or acidity, while Vata imbalance might cause dryness or anxiety. Then there are customized treatments according to the person's Prakriti, including herbal medicines or herbal remedies or therapies and detoxifying practices. They are customized according to a person's Prakriti and any dosha imbalances. Prakriti also talks about mental and emotional well-being. Prakriti affects mental and emotional tendencies. For example, Kapha person may have a calm, steady disposition, while a Vata person might be more prone to anxiety or restlessness. Understanding this can help managing emotions and emotional health and stress. If you have understood the role of Prakriti in health, let us now move on towards the assessment of Prakriti, how a person's Prakriti can be assessed by a physician. So, first way, one of the ways in which a Prakriti can be assessed is diagnosis. And the second way we can assess Prakriti is by using personalized approach. In diagnosis, we can observe the person or we can give that person some questionnaire or we can ask some questions to that person. And the second way we can do it is by asking for personal history. So as we have seen in the last video that some disorders or diseases are genetic as well. So if we get the personal history of that person's family or relatives, then we can understand, we can diagnose the person's Prakriti very well. Now let's understand what will come under personalized approach. Tailored recommendations. So based on the assessment, Ayurvedic practitioners provide personalized recommendations for diet, lifestyle, and treatment. Now let us understand the pulse diagnosis or Nadi Pariksha. This is a unique method of diagnosis in Ayurveda. The practitioner places their three fingers on the patient's wrists to feel the pulse. Traditionally, three fingers are used: index, middle, and ring finger, which corresponds to three doshas: Vata, Pitta, and Kapha. Nadi Pariksha has been practiced for thousands of years and is revered part of Ayurvedic tradition. The pulse is evaluated based on several characteristics. First characteristic might be rhythm of the pulse, the strength of the pulse, and volume and quality of the pulse. So now understand which characteristic belongs to what type of dosha. So Vata dosha. So here the pulse is typically felt as light, quick, and irregular. It might be described as thin and fluttering. For Pitta dosha, the pulse is often experienced as moderate in strength and regular, sometimes described as sharp and forceful. For Kapha dosha, it usually feels strong, steady, and slow, often described as heavy and smooth. Nadi Pariksha offers a holistic view of a person's health. It is used in conjunction with other diagnostic methods like observation, questioning, examining to create a comprehensive health profile. Now let's understand the concept of Agni and digestive health. Agni is translated as fire. It symbolizes the digestive and metabolic processes within the body. It is considered the transformative energy that converts food into nutrients and waste. There are few types of Agni that we are going to now talk about. First is Jaఠaragni, the main digestive fire located in the stomach and small intestine is called as Jaఠaragni, responsible for digesting food and extracting nutrients. The next type of Agni, the second type of Agni is Bhutagni, the digestive energy in the liver and other organs that processes and metabolizes the elements derived from food. The third type of Agni is Dhattva Agni, the metabolic energy associated with seven dhatus like tissues, including blood, muscle, fat, bone marrow, and semen, and connective tissues. So these are the seven dhatus. It governs the transformation and assimilation of nutrients into these tissues. A balanced Agni ensures efficient digestion, nutrient absorption, and elimination of waste. It supports our overall health, energy levels, and immunity. So there are three types of Agni: Jaఠaragni, Bhutagni, and Dattvagni. So these Agnis have different functions. So the balance in these Agnis ensure efficient. Imbalances in Agni can lead to various health issues, including digestive disorders, metabolic disturbances, and chronic illnesses. Maintaining Agni is crucial for preventing disease and promoting. Now let us understand types of imbalances. First is Vishamagni. It relates to irregular digestion marked down by fluctuating appetite, inconsistent bowel movements, and digestive discomfort. The second Agni is Tikshana Agni, excessively strong digestion leading to conditions like acidity, heartburn, or ulceration. The last is Mandagni, weak digestion. It results in the symptoms such as poor appetite, heaviness, indigestion, and fatigue. Now let us understand the causes of imbalance. Factors contributing to Agni imbalance include improper diet, stress, irregular eating habits, environmental changes, and lifestyle factors. How can we restore that Agni? So, first and foremost thing that we can do to restore Agni is adjust our diet. So, eating warm, easy to digest foods, incorporating digestive spices like ginger, cumin, and fennel, avoiding heavy, cold, processed foods can help restore Agni balance. Then we can incorporate lifestyle practices in our day-to-day life. Maintaining regular eating schedules, eating in a calm environment, and practicing mindful eating can contribute to healthy digestion. If you have understood about Sushrut Samhita, then Prakriti, and then we have talked about Agni and digestive health. If you have understood that, we'll now move on to Ayurveda and mind body connection. We will now focus on the key aspects of Ayurveda. Few of these aspects have already been seen by us in last video and in today's video as well, like the role of Agni, then dosha influence and on mind and body. We'll now understand the dosha's influence on mind and body. First, we'll understand Vata dosha. Hmm? The mental characteristics of people who have dominant Vata dosha are creativity, anxiety, and variability. Imbalances can lead to restlessness, nervousness, and mental fatigue. Physical impact relates to disruptions can manifest as dryness, irregular digestion, and joint issues. Pitta dosha's mental characteristics are focus, determination, and intensity. Imbalances can result in irritability, anger, and frustration. Its physical impact is excess can cause inflammation, acidity, and digestive problems. So, excess of Pitta dosha can lead to inflammation, acidity, and digestive problems. Now, let's understand the characteristics of Kapha dosha. Kapha dosha's mental characteristics are the person is calm, he has stability and attachment. Imbalances of Kapha dosha can lead to lethargy, depression, and stagnation. Its physical impact includes results in excess weight. Okay, so the physical impact of Kapha dosha imbalance can lead to excess weight, mucus buildup, and sluggish digestion. Now let's understand the role of Agni in Ayurveda. So mental and emotional health, and it can lead to like there is twofold role of Agni. First is mental and emotional health. Okay, a strong Agni supports not only your physical digestion but also mental clarity and emotional stability. Poor digestion can lead to the formation of toxins which are called as ama, which affect our body and mind and emotions. Proper digestion supports mental functions as the body's energy and nutritional needs are met, promoting overall well-being. Now let us understand mind and body therapies in Ayurveda. Meditation, yoga, and Abhyanga. These are the three therapies that are prominent in Ayurveda. Ayurveda emphasizes meditation as the practice to calm the mind, reduce the stress, and enhance mental clarity. Regular meditation supports mental balance and emotional resilience. Integrating yoga with Ayurvedic principles help harmonize body and mind. Specific asanas and pranayama, which are breathing exercises, are tailored to balance these doshas and support mental health. Abhyanga means oil massage. Regular self massage with warm oil promotes relaxation. It reduces stress and nurtures both physical and mental health. Let us now understand emotional imbalance and physical health. Stress and diseases. So, chronic stress and negative emotions can disturb dosha balance, leading to physical ailments such as high blood pressure, digestive tissues, and immune dysfunction. It relates to the Ayurveda also talks about healing emotional imbalances. Ayurvedic treatments focus on balancing emotions through lifestyle changes, dietary adjustments, and therapies that address both mental and physical aspects. Ayurveda also talks about diet and mental health. So, food choices and mindful eating are incorporated in Ayurveda so that your mental health is well balanced. Ayurveda also talks about seasonal and daily rhythms. Aligning with nature, Ayurveda advises aligning daily routines and activities with natural cycles, day and night seasons, to support mental and physical harmony. Disruption of these rhythms can lead to stress and imbalance. Maintaining a regular daily routine, that is dinacharya, helps stabilize dosha and support mental clarity and emotional balance. In Ayurveda, we are also going to talk about psychological factors and physical health. Clear and positive thinking promotes balanced dosha state, improving physical health and preventive diseases. Recognizing and addressing emotional issues through Ayurvedic practices help in maintaining overall health and preventing psychosomatic disorders. So, Ayurveda also talks about emotional. Here, we are done with chapter 9. I hope you have understood the content that is given to you. And thank you for watching this video. I hope you have learned something new again. We'll now stop with our video. Thank you.